from Paris on the US Airways flight. I've learned a lot. I was looking at the In-Flight magazine and about the importance of these hair surgery implantation presentations. I have found in this paper, in this journal, 5 whole-page advertisements. The first was about matchmaking, about love life. The second was about recruiting US veterans. And the others were about laser cap to prevent hair loss, neograft system, and robotic hair transplantation. So it's a very important afternoon now. My presentation now is about something else, something different, another point of view. We are hearing about sophisticated filling techniques, robotics, and others. And I had the idea to present something about a population that has never seen any doctor before. What kind of dermatological problems do they have? So this was a humanitarian mission in Uganda, Africa. On the first image, you can see a waiting room. The people are waiting under the mango tree. Uganda can be found in the equatorial area of Africa, in a conflict area close to Congo, Rwanda, and South Sudan. Okay, here you can see these crisis areas around the country. We were working around the Lake Albert, which is a zone that is considered to be very dangerous because of the malaria, the most dangerous type, the falciparum, the Ebola, and other diseases. So the preparation was just like any other humanitarian mission: physical, psychological, medical knowledge, and an ideal team was tried to be constructed. The first confrontation we had was quite dramatic. We had to realize what kind of health system do they have. So what kind of options do they have there in Africa? Go to see the local healer. This is the same guy as you have seen this morning, but this is in the state of the trance. Go to the local GPs. This is the office of this colleague who has experienced blood sugar control at the age of 74 after spending all his life as a doctor. The room was empty. Or to go to a local hospital. This is the hospital garden, not a botanical garden. You can see the family members of the patients who must wash, cook, and take care of the patients. This is the operating room, which was not functioning at all. It was used as a stock for boots. Okay, the other questions: how can we work? What kind of conditions? This was a Woodstock, the first consultations we had. And this colleague, Anna, who is over 60 now with a hip prosthesis, he had to climb on these woods to be able to receive the patients. This is the same building from outside. So we were inside, all of us. Or we could work in local schools and local churches. That means that teachers and priests understood the importance of this mission, and they were helping us. So, of course, it was a mission in Africa, but we must not forget that due to migration, global climatical changes, re-emerging diseases, we can find these pathologies in the United States or Europe or Switzerland or anywhere. Just some data about the migration, considering the European Union. And for me, here, this is quite an important line here, that migration to my country, Hungary, or to France, where I work, represents about 50% of the immigrants coming from Africa out of the Union. But in Italy, the percentage is much higher due to the immigration. You can hear about the boat people recently. Also an interesting fact that south of Europe is a risky area concerning the malaria. So some of the tropical diseases that may have dermatological manifestations. And we must not forget that not only tropical diseases, but diseases occurring in the States or Europe, like TB, may have different manifestations, or a simple example, flu is present all year around because of the climatic conditions. These people had no access to drinking water, electricity, canalization, medical service, or shoes. HIV is estimated to be around 10 to 20%. Smoking and drinking was not present because of poverty. But interestingly, reflux disease was as frequent as in Europe. Okay, some of the risk factors. There were no shoes, so a way of penetration is walking barefooted. How to dry the washed clothes on the grass close to these animals, a way of propagation of many pathologies. This is a village, a fishing village on the Lake Albert, and it's quite a nice image, but you must not forget that in a small home like this, there's only one room, and at least 10 to 15 people live here inside without any comfort. Also, in the same lake, they are washing, bathing, and taking drinking water, which may explain the high incidence of bilharziasis in this area. So the country, as many of the African countries, represent a very young population. About the pathologies, in red, I tried to mark those pathologies that are related to the skin and the genitals. The percentage altogether is almost 20%. The most important pathologies were masses, abdominal pain, and musculoskeletal problems. Just some example, a salivary gland tumor, like a mass, abdominal pain, mostly due to worms. This was a sickle cell anemia patient with swelling of a joint. And about the skin diseases, infectious diseases like scabies, impetigo of the ear, varicella, genital disease, gonorrhea. Once again, scabies, he's touching his head because of this pain. Another case of varicella, myiasis, larvae present in the external ear, stenosis of the external ear with hearing loss due to these infections. Another case of impetigo, viral papillomatosis, multiple abscess, worms, migrating larva, mycosis of the head in the frontal area, the axillary area, head and neck area once again. This patient, you cannot really see, but there were hypopigmented areas, and my colleague is controlling the sensation. This patient had leprosy. Or congenital diseases like Recklinghausen disease, congenital malformation causing trophical problems, melanoma, and scarring of the head. So when I was preparing, I was thinking about your presentation, about the indications, more extensive one. And here you can see some scares. And something was very interesting, that these people did not came because of cosmetological problems, but secondarily, when we were asking them questions about, we have revealed that they have these problems except for being bald, because it's considered to be a sign of cleverness. So I won't benefit from this treatment. And it was very interesting. Here you can see psychiatrists in the same area. And it was due to traditional healing and incision, and they used to put medical plants and ashes inside. But this was the main indication why people wanted to be operated. Once again, And unfortunately, they have tried this kind of healing. You can see the small scars in case of severe diseases like filaria. This was a young girl of 12 years, filaria again, and you can see the incisions, of course, he was not healed by. And as well, surgical scars were present. And we had to ask questions about these patients who had sinus tumors or serious mycosis, how to make a reconstruction after surgery. I must admit that these patients were not operated. We are planning to open a Hungarian hospital there this year. Okay, so here you can see the statistics, but I don't want to speak about these numbers. So thanks for the attention.